Rommie Duckworth here, talking to you about coordinating rescue care for crush injury and crush syndrome, which I'll be presenting at EMS Today at the National Harbor in February 2019. Crush injury and crush syndrome, and all of the terms surrounding those two concepts can be really challenging to sort out, primarily because a lot of times some terms get used in an overlapping manner, and very often the terms get used incorrectly. We're going to focus on differentiating that initial crush injury, the soft tissue injury, and the initial bleeding control that you're going to need to do, and really focus on good, rock-solid, immediate trauma care, but also coordinating for crush syndrome, which is a later process that begins at about 1 hour and really starts showing signs and symptoms between 4 to 6 hours. And we're going to get into the pathophysiology of the 3 primary mechanical problems that are at issue with crush syndrome, as well as the 3 primary chemical problems that are there trying to silently kill your patient, whether it's somebody who's been pinned in an automobile accident, there's an outdoor wilderness rescue, and they've been lying at the bottom of a ravine or a fall from a hike, or just a little old lady who fell down in her bedroom trying to go to the bathroom in the middle of the night, but she's been laying on the floor all night. Any of these patients might be at risk for crush syndrome. We're going to teach you how to identify it, how to make sure that you're doing the right treatment right from the very beginning with your first patient contact and your initial assessment, through extrication and removing this patient, and most important, getting the concept through that we really need to coordinate at every step of the way with our EMT and paramedic level providers, with our rescuers, with our hospital-based personnel. There's a reason that crush syndrome, when it was first discovered, was called the Grateful Dead syndrome. As patients were rescued initially from building collapses and trench rescues and the like. They were pulled out and they were grateful to have been rescued. And then shortly after, within hours to days later, they would die for reasons that nobody quite understood at the time. Now we understand them a lot better. So we want to make sure that we're providing that initial care, getting those patients properly identified if they're at risk for crush syndrome, and again, coordinating at each step of the way at both the EMT and the paramedic level. We're going to give you high-profile incident protocols and really get to the bottom line, which is when you see pressure plus time, think crush syndrome. I want you to be there for the discussion. I want you to ask good questions. I want you to challenge me and the other people in the room. And we're all there to share the resources that we have. If you're coming there because you've got good crush injury or crush syndrome protocols, that's why we all get together at a conference like EMS Today. It's about sharing with everybody in the room. And so I hope to see you there. I hope to learn from you. I hope to be able to share some things that you'll be able to take home and that we'll all be able to up our game when it comes to providing excellent pre-hospital care.